Hey everyone, my name is Conrad Powell and I'm a Senior Project Manager at Diabetes Action Canada. My work is focused on data-driven evidence, evidence to prevent the complications arising from diabetes. So basically, how can we use data to identify individuals who have the greatest risk for a worst outcome and inform their family doctor or their care team so the patient can be contacted for preventative intervention? So more of providing proactive care rather than reactive care. And also promoting health literacy, so the patient is part of the decision-making process. This work fascinates me, working with state-of-the-art data, artificial intelligence researchers, and they sift through billions and billions of data points to generate all this data-driven evidence. While this is so exciting, this new era of big data, a major driving force behind my passion in this space is because of this type Wonder Woman right here. This is Chloe. She is my youngest daughter and was diagnosed with type 1 diabetes 3 years ago at the age of 4. She started kindergarten, and then one day, Halloween Day 2018, everything changed in an instant.
Hi everybody, my name is Chloe and I have type 1 diabetes. It was a really scary time for me. I was in the hospital. I had needles and tubes. I was scared. I was crying. The nurses and doctors told me everything would be okay.
Now, even though I was in this space, it didn't prepare me for this new reality. The new reality of knowing that I was effectively acting as Chloe's pancreas. That I had to bring my A game every single day. And I would always second guess myself. Did I give her the right insulin? Did I mix up the bolus and the basal? Was it the right amount? The stress and the worry that is associated with that is incredible. But Chloe was in my care. And as long as she was in my care, I knew I got this. But the sad reality is she would not be in my care all the time because I had to send her back to school. A school that was an hour away from my work. A school that, they didn't know the warning signs of hyper or hypoglycemia. I have to tell you, it was one of the hardest things that I had to do to trust her care, her life into the hands of someone else. My stress level hit the roof. So I decided to meet with her school. And meeting with Chloe's teacher and her principal was great, but 1 week into it, it was blatantly obvious that they completely underestimated the care that was needed for a student living with type 1 diabetes. On top of that, Chloe was telling me that some of the kids in her class didn't want to play with her, as they knew Chloe went to the nurse's office every day, and they were afraid of catching whatever Chloe had. So this is where the advocacy kicked in for me. No one was going to fight for her or give her a voice, so I did. I made an appointment with her teacher and principal, and I even went to her class to do a presentation to them. So there I was, standing in front of a room of 4-year-old kindergarten kids, and I taught them what type 1 diabetes was, and I stressed that they could not catch this from Chloe. It came to a point where Chloe going to the nurse's office became an educational thing, and Chloe got to pick a kid to go with her each day. They would all put their hands up and say, "Choose me, choose me." And this made Chloe so happy because she had the opportunity to choose a kid to go with her and then to explain exactly what was happening. And this gave me the relief because we just removed that stigma of there being something wrong with Chloe. When it came to educating the staff, I printed out the guidelines for care for students living with diabetes at school. And I tell you, this position paper came in so handy so many times. At one point, Chloe was asked to sit out during her gym class for fear of going low, but she wasn't in the danger zone. And then shortly after, Pancake Tuesday came along, and Chloe was going to be excluded from that. But it wasn't going to happen on my watch. So here you go. The first thing that you'll read on this position paper is this. Students living with diabetes have the right to be full and equal participants in school and all school-related activities without the fear of being excluded, stigmatized, or discriminated against. And here's the link. Feel free to click on this or note it down and take it with you. So I ask you now, can Chloe participate in gym class? Well, why not? She may just need an extra snack. Can Chloe participate in Pancake Tuesday? Can she join in that fun? Well, why not? She just needs insulin. Can Chloe participate in everything and anything just like any other kid? Well, why not? Shortly after Chloe's diagnosis, McMaster Children's Hospital, where Chloe was diagnosed, reached out to us and asked, based on their interactions with Chloe, if she would be willing to mentor other kids who were recently diagnosed. They were impressed with her attitude and thought that it would have such a positive effect, which it did. I still remember that day. Chloe video called one of the kids. They were a bit apprehensive of putting on the Dexcom sensor. So Chloe was there, she videotaped herself, she put the sensor on, and she just showed that little girl that, you know what, if I can do it, you can do it. And that just warmed my heart. And right then, I can see that Chloe got bit by the advocacy bug. She wanted to be involved in spreading awareness of type 1 diabetes and helping others. A year after her diagnosis, Chloe wanted to do something for her Diaversary. Diaversary is a 1-year anniversary, and every anniversary after of her diabetes diagnosis. She created giveaways, and basically what it said, well, here's a picture. It basically said, I didn't get diabetes from eating too much candy. And then it listed the warning signs of type 1 diabetes. A few days later, the teacher called us in, and while breaking down in tears, she told us that based on the cards that Chloe gave out, she noticed the warning signs in another child. She told the child's parents, and, that child was diagnosed with type 1 diabetes. Can you see that? The power of Chloe sharing her story helped another child from being diagnosed. While in DKA, she was diagnosed ahead of it, and she was caught early. She was one of the lucky ones. Wear Blue for Chloe. This is a campaign that we started shortly after Chloe got diagnosed, and it was mainly to bring awareness to type 1 diabetes, to get people talking about the good, the bad, and the ugly parts of it. And yeah, there is good about it. The good is meeting the community and connecting with all these amazing people and empowering them by providing support. Then we have the not so good stuff, the carb counting, the finger pricks, the needles, and then the ugly stuff, right? The complications associated with diabetes, the mental health toll that it takes, and just the general well-being. So we wanted the discussion going on. So we started this campaign, Wear Blue for Chloe. We got Chloe set up with an Instagram account right here. It's called MyT1D, and it's the raw, real truth of growing up with type 1 diabetes. And this campaign, it started off to get people talking, and they did. And we got amazing support from the community. We got Olympic athletes and TV personalities and musicians, and then the everyday people just like me and you. And it didn't stop there. Chloe wanted to do more. And here's just a little, here's some snapshots of different things that she's been involved in. From print to TV to speaking at different events. I mean, if anything, Chloe has latched on to being an advocate, a fierce advocate for type 1 diabetes. And I'm telling you right now, you will see more of her because she is not going to stop. I want to talk to you a little bit about social inequities. It's no surprise that people come in all forms, all shapes, and in all walks of life. And this actually highlights the socioeconomic differences. Some insurance companies cover insulin pumps and CGMs. Others pay out of their pockets. Now, most provinces, unfortunately, do not cover CGM or flash monitors. So why should Canadians have different options of coverage depending what province they live in? I mean, shouldn't there be a national body that basically says we are going to cover this for every person in Canada who's living with diabetes? I mean, why should they be penalized for something that happened to them? They didn't choose diabetes. It just happened to them. So this has to change. Why? Well, why not? So in January of 2020, Diabetes Canada stepped in. With the help of their staff and volunteers, they created an open letter to policymakers to push for provincial health authorities to cover this technology. A couple months ago, Manitoba just announced in their latest budget that the province will cover continuous glucose monitors and insulin pumps for people under 25 years old. Can you see that? A little bit of perseverance. Things can happen. You can make a difference. Now, there's also many provincial disparities. When Chloe was diagnosed, we were lucky to have a nurse assigned from the Community Care Access Center in Halton. And a nurse came to Chloe's school twice a day to give her insulin. And this was such a huge relief to us, because prior to that, I had to take time off work, and I went to Chloe's school twice a day to give her insulin. But every province is different. Earlier this year, news reports surfaced that a 5-year-old boy in Halifax with type 1 diabetes would go without insulin at lunch at his school. Now imagine that. With the absence of a proper care plan, and because of his inability to count carbs and self-administer insulin, this poor kid had a blood sugar reading of around 15 to 20 millimoles per liter after lunch. And he had to remain like that until his parents picked him up to go home. Now, this is completely insane, but the sad fact of the matter is that this happens more and more, and it's very common across Canada. Now, Diabetes Canada has been advocating to change this for years, and although most provinces have policies or standards of care for kids with type 1 diabetes, most don't require someone on site to be trained to administer insulin. And this has to change, and we need to advocate for this change. Why? Well, why not? One of the most recent success stories was the successful push for Diabetes 360. In the summer of 2018, Diabetes Canada released a report making recommendations for a national framework for diabetes. This was called Diabetes 360. The report highlighted the fact that most progressive countries have recognized the burden of diabetes and have decided to dedicate funds to stop this epidemic from progressing further. A push for federal funding in 2019, unfortunately, went unanswered. But that didn't stop the determined and dedicated staff at Diabetes Canada. Another push for federal funding in 2020 with a huge campaign, but that also went unanswered. But that did not stop. The staff and volunteers pushed even harder, and in the federal budget in 2021, the most recent budget, the federal government announced funding $35 million over 5 years for diabetes research, surveillance, prevention, innovation, and the development of a comprehensive diabetes framework. Amazing. And additionally, thanks to the tireless effort of the volunteers and the staff at Diabetes Canada, the budget also included changes to the disability tax credit. And it actually made the eligibility criteria easier to justify. And this will provide much needed support to thousands of patients living with diabetes in Canada. And another key recommendation in the report was a call for a national diabetes repository, so we can actually measure the burden of diabetes disease across Canada. Now, I personally am so happy to see that, and I'm thrilled to say that this has been an initiative that I've been managing since 2018 while working at Diabetes Action Canada. And we now have a national diabetes repository that represents patients from 5 provinces in Canada, with plans to expand so we can have full representation. So here's a quick snapshot of the National Diabetes Repository. As you can see, we almost have a 50-50 split between males and females. There's just under 150,000 patients that are represented in the system. And if you look at the numbers, you can see we have over 1,300 physicians contributing to this, with over 1.5 billion data points, lab tests, prescriptions, and so much more. The platform itself is housed in a secure facility that's compliant to international standards and privacy legislation. And the best part of this is it is a patient co-created platform. Patients have created this, and they've told us how they want the data to be used and accessed, how they want it to be stored. And the oversight over the use of the data is through a research governing committee, where 50% of the committee is made up of patients. So they have a direct say into who can access the data and for what purpose they can access it for. There are a number of projects that are currently using this resource right now. One in particular was conducted by Dr. Alana Wiseman, and it was published in the Canadian Journal of Diabetes. The impact of government-funded insulin pump programs on insulin pump use in Canada. So basically, if a government funds a program to pay for or offset the cost of insulin pumps, will there be an uptake in the use of insulin pumps in Canada? Now, the results of this study, which come at no surprise, have highlighted the inequity to access of insulin pumps within Canada. And this should actually be used to advocate for universal access. This can be changed. We can have this in Canada. We have a voice. We can do it. So here is my call to each and every one of you to make a difference. You can be a part of this movement. You have a voice. You can use it. Why not? There are a number of ways to get involved in being an active advocate for yourself and others living with type 1 diabetes. You can make a positive change by volunteering with Diabetes Canada's Advocacy Department, or connect with the Diabetes Canada virtual display at today's conference. Go on the website or simply call 1-800-BANTING.